The neck is broadly divided into two major triangles: the anterior triangle located at the front of the neck and the posterior triangle located on the side of the neck. The anterior triangle is bordered by the midline of the neck medially, the lower border of the mandible superiorly, and the anterior border of the sternocleidomastoid muscle laterally. It is further divided into four smaller triangles: the submental triangle, which is located beneath the chin and is bordered by the hyoid bone and the anterior bellies of the right and left digastric muscles. The submandibular triangle is located between the mandible superiorly and the posterior and anterior bellies of the digastric muscles. The carotid triangle, which is an important area housing major blood vessels like the carotid artery and the internal jugular vein. It is bounded by the posterior belly of the digastric muscle superiorly, the anterior border of the sternocleidomastoid muscle laterally, and the superior belly of the homohyoid muscle inferiorly. The fourth subdivision of the anterior triangle is the muscular triangle. It is bounded superiorly by the hyoid bone. It is bounded laterally by the anterior border of the sternocleidomastoid muscle and medially by the midline of the neck. The posterior triangle is located on the side of the neck. It is bounded anteriorly by the posterior border of the sternocleidomastoid muscle, inferiorly by the clavicle, and posteriorly by the anterior border of the trapezius muscle. It can be subdivided into two major triangles: the occipital triangle and the supraclavicular triangle. The occipital triangle, which contains the cervical plexus and the accessory nerve, is bounded anteriorly by the posterior border of the sternocleidomastoid muscle, posteriorly by the anterior border of the trapezius muscle, and inferiorly by the inferior belly of homohyoid muscle. The supraclavicular triangle, also called the subclavian triangle because it contains the subclavian artery and vein, is bounded inferiorly by the clavicle, anteriorly by the posterior border of the sternocleidomastoid muscle, and superiorly by the inferior belly of the homohyoid muscle. Understanding these triangles is crucial for clinical practice. For example, the carotid triangle is important for checking pulse, and the posterior triangle is significant for locating the accessory nerve and the subclavian vessels. In summary, the triangle of the neck provides a structured way to study and understand the anatomy of this vital region, whether in medicine, surgery, or anatomical studies. Knowing their locations and boundaries is essential.